What is an ACL tear and why does it keep happening? We see a lot of ACL tears in our athletes, whether it's football, baseball, ice hockey, or even basketball. Why does it keep happening? Breaking down ACL and what it stands for. The A stands for anterior, which just means front of. The C is cruciate because that ligament is in the form and shape of a cross. And then the L, of course, stands for ligament. Now, talking about the ACL, we're specifically talking about the knee, right? That ACL ligament stays inside of the knee and gets aggravated on three specific movements, usually in that order. The first movement is planting the foot. So planting the foot into the ground. The second is hyperextending the leg, so locking out that knee completely. And then the third is twisting or turning. Those three, planting, hyperextending, and rotating, are the general mechanism that causes an ACL tear. We see it a lot with our athletes because they are on a field, whether they're looking to make a tackle or shoot a goal. We see those three actions fairly commonly. It doesn't always have to be coming from an athlete, though. In fact, my last patient, she was in the kitchen and she was getting a dish from the top cabinet to put down on the counter, and she ended up suffering an ACL tear from that. What had happened is when she went up, she planted her foot into the ground, thereby also hyperextending her leg and her knee. And then thirdly, when she grabbed the dish, she brought it around and set it on the counter, and she heard a snap and she fell to the ground. It related to an ACL tear after she got imaging to confirm. Remember, ACL tears don't have to have an extreme mechanism of force, whether that's on the football field or just at home in your kitchen, but they can happen to you. It's vitally important to see a doctor, specifically an orthopedic, to rule in or rule out an ACL tear through imaging and clinical diagnostic testing.